Thank you everyone for being here and sticking it out until almost the end. I'm an emergency medicine doc who also practices integrative medicine and lifestyle medicine, and many integrative practitioners across the country and in other countries have found themselves drawn into care for long COVID patients because we were already seeing patients with chronic fatigue syndrome, fibromyalgia, Ehlers-Danlos, lots of other syndromes that don't necessarily fit neatly into another specialty. So as we've already heard, long COVID is very challenging. There's more than 50 symptoms. It's difficult to describe. It manifests differently in each person. And what I want to point out here is that as of 2024, already still 17 million adults still have long COVID. 2 million of them are out of work. And it's astounding that even the year prior to that, 43 million still consider themselves to have long COVID and have resolved. But these are huge numbers with a very large disease burden. So as we've already heard, it affects almost every system in the body. And now you're going to see we all love this table here, this graph that shows the frequency of the different symptoms. And you can see that 58% of the patients have fatigue. And this is old. This is from 2021. And I would say, just anecdotally from the patients that I've seen, that more than 58% have chronic fatigue. And on the bar graph you see on the bottom, at the tiniest number up at the top is paranoia. And that's even been associated with long COVID. So you can see it's very complicated and affects every system. This is a little busy, but I'll just explain it. The symptoms do seem to cluster. So if you're a primary care physician or clinician and you see patients with these multiple symptoms, this might be a good way to think about them. And the shorter bars, like in the green that you see at the bottom, those symptoms are more tightly clustered, and the ones at the top in blue are more generally clustered, if you could say that. So for example, many people have brain fog and many people have fatigue, whereas some of the more GI type symptoms are more specific and clustered together for some of the patients. And then we can't forget the fact that long COVID has worsened some pre-existing conditions, and you can see them all here. So I do try to pay attention to what's happening with those prior medical history, medical problems that are in the chart, and because they are in some cases getting worse and do complicate the other newer symptoms. The mechanisms we've heard, again, are multifactorial, and patients frequently have more than one of these at work, and it's not always clear which one is most prominent. I will say the inflammatory mechanism is probably the most common and overarching, but let's not forget to look at some of these other mechanisms and pay attention and treat them. For example, the mitochondrial dysfunction and the post-exertional malaise are probably connected. And so, again, we need to be thinking not only just symptoms, but mechanisms. So why a whole person approach? So as we've said, this is a disease that's difficult to define. There are multiple mechanisms, no confirmatory tests, no single fix, no single medical specialty. And I will say, as a clinician, this is very challenging for all of us. We don't like not knowing. And many patients have reported feeling very dismissed by their clinicians. And it's unfortunate to hear that, but I can understand it in a way. When there's a workup done, there's no objective findings, and the clinician doesn't feel they have anything specific to offer the patient. So patients are continuing to fall through the cracks, and we hope this webinar will help avoid that. So what is a whole person approach? You can look at it from lifestyle lens or integrative medicine lens. And I'm not going to go through all of these, but we do try to look at the person in a whole way and include their lifestyle, their preferences for treatment, what's culturally congruent, and look at both conventional therapies and complementary ones. And just so I always remind myself of this, that healing is always possible, even when curing is not. And I think if we communicate to that to the patients, I think it's helpful for us to think about and for them to know that we're thinking that way. So the whole person health index has been recently validated by the NCCIH, and it is similar to the PROMIS 10, the Global Health Index, and you can use either one of those. They're pretty quick to administer. I think this one really looks at health from the patient's perspective. For example, if you're asking about physical activity, you're asking, compared with other people in your age group, not comparing an 80-year-old to a 20-year-old triathlete, for example. But we want to really know how they're perceiving their own health. A score greater than 30 is less healthy. A score under 20 is more healthy. And I think it's really interesting to see, as you can see on this radar graph on the right, that someone might rate their quality of life quite good, but their ability to sleep and their stress is really bad. So it does help us focus in on how we can help them move over to the left side of the radar table here by focusing on the aspects of their health that they consider most troubling. So a little clinical vignette. We've heard lots of these symptoms, so I'm not going to go through this, but the little cartoon shows a clinician kind of throwing the whole kitchen sink at the patient, which is really not what we want to be doing, but it does end up that way. And I'm sure you've all seen patients who have seen maybe many practitioners out there who are throwing the kitchen sink at them. So we try not to do that. And this just kind of highlights the fact that they have multiple physical symptoms. They're disconnected from their work, perhaps because they're not working anymore. They've seen multiple clinicians, they feel dismissed, and then they have all of those other pre-COVID conditions. So I let the patient warm up a little bit by asking them the whole person health index. So that kind of lets them know that I'm going to be asking them about lots of different aspects of their health. And one of the most important things I think that we do is letting the patient tell their story because they don't feel heard. And I think just letting them go through it is very part of an important part of the healing process. And then I review their medical history, their medications. Don't forget to ask about supplements and other things they might be doing, like hyperbaric oxygen therapy. Then I go into their diet, if they're using any substances, how they're sleeping, how their daily functioning is doing, including their cognition, and what their physical activity is like, their stress, their mood, and their connection. It is a lot. So just to go through a little bit of these in more specifics. So food as medicine. I truly believe this. There's lots of evidence showing how much food and nutrition does affect our health overall. The anti-inflammatory style of eating is kind of the go-to initially with the small changes for people who have hypertension. We recommend the DASH diet and then the MIND diet if they're really having cognitive challenges. Then there's, of course, low histamine style of eating for people who appear to have some sort of mast cell reaction. There's the low FODMAP, which we've heard about earlier, other types of elimination diets. And then let's not forget the anorexia that people experience because of loss of smell and taste. And many people have had huge amounts of weight loss and are actually considered malnourished by the time that they're seeing us. And then, of course, the microbiome. This is a quick tool you can use. You can hand them out or put them in their after visit summary in Epic. Anti-inflammatory pyramid, which we see at the bottom, focuses mostly on fruits and vegetables. We do want it to be plant slanted. And at the top, reassuringly, there still is room for a little chocolate. So I literally give them a list of eat more of this, eat some of this, and eat none of this. Because no one can really live on a diet. But I think if they just see a list of foods, they can start incorporating that into their day-to-day. And here's some things to avoid. And then the healthy eating plate, you can get a PDF that's downloadable and printable. from the web, and it comes in different cultures and styles of eating as well. If you have an Asian patient, if you have someone from a Hispanic background, it's more culturally appropriate for them. But basically, I tell them every meal and snack, think of it as a plate, with the largest quarter being vegetables, smaller quarter fruits, another quarter being a healthy protein. Again, it can be plant-based, which is helpful, and then whole grains. And I usually do a lot of explaining about what whole grains are. And then don't forget the water and hydration. Sleep, we go over sleep. Many people are having major sleep issues. How much? It's a little different for different people, but 7 to 9 hours. Most people report unrefreshing sleep. So, as we've heard earlier, some people are sleeping a lot, but they still wake up feeling unrested. And that's really the thing that I try to focus on. Some of the digital devices are very helpful. We want people to be getting enough deep phase sleep and REM. And some people do need to go and have sleep studies. We have identified many people with some sleep apnea, but I would say mostly minor and not really requiring CPAP, for example, although some people do have preceding sleep apnea. And of course, they need to be reminded to wear the masks. We go over sleep hygiene. Some pharmaceuticals can be helpful. If someone's not sleeping at all, I have no problem prescribing some trazodone short term. And then there are many supplements and botanicals that are helpful. And then, of course, CBTI, that's cognitive behavioral therapy specialized for insomnia, can be helpful. And then brain fog. I'm talking about this specifically because this is such a difficult set of symptoms to get at and even describe, as you can see from this chart. Everything from clear-cut confusion bordering on a patient that might look like they're having some early dementia to just losing your train of thought, not finding the right words, feeling a little slow in their processing. And this contributes a lot to why people stop working. And the causes of brain fog are many. We should look at all of these and not forget to think about other illnesses. There's thyroid issues, there's hormonal changes. I see many women who are in perimenopausal phases of life and they aren't really sure if it's long COVID or if it's menopause. And honestly, we can't really tell them, but the fact that we're addressing all of it helps them feel a bit more reassured that we're thinking about their whole picture. So the assessment, we've heard a little bit about some of this. I do send people for neurocognitive testing. The speech therapists have been amazing. Thank you, thank you, thank you. Some people do require some imaging. We haven't seen a lot that helps in the imaging realm. Then there's nutritional deficiencies, substance use, of course, we have to address, and then the sleep studies. And management just goes along with some of what we find from the testing. Some of the supplements and botanicals that we use, you can see listed here. Some have been used for centuries, literally, like rhodiola and Ayurvedic medicine, bacopa, and different things that are more commonly taken, like magnesium, vitamin D. But I don't throw the kitchen sink at the patient. I try to be very targeted and explain why we're using these things or recommending them, just like we would with a pharmaceutical. Physical activity, we've heard quite a bit about that. And again, the post-exertional malaise is the most important thing to think about. People are used to thinking about the fact that if they do more, they'll build more stamina, and that is not the case in this particular disease process. And so we have to walk that back quite a bit and talk with them about how to manage it. Stress and mood. We know that stress and mood affects your immune system, even affects your bone strength. And so I do spend time talking with people about how to balance their autonomic nervous system. Again, some of the digital devices that look at heart rate variability can be really helpful. It's really easy, even if you're a primary care doctor, to just do a simple breathing tool with the patient while you're sitting there. You don't have to wait for them to see psychology or psychiatry. 4-7-8 breathing is easy to teach, and I show it and do it with the patient just to prove to them how quick it is to do. There's lots of resources online now for yoga, qigong, tai chi. Qigong has been used all over the world for people with shortness of breath from COVID and long COVID. And that's kind of the silver lining of COVID, that we have so many resources online. So I do give those to the patient. Journaling can be very helpful, even 5 minutes. Guided imagery, there's all kinds of apps to use. And then there's a therapy mindfulness book that I just love. And this is just one example of the chapters. A painting by Andrew Wyeth called Christina's World. The theme of this chapter is move forward even when you are in pain and hurting. And this woman in this painting is actually unable to walk, and she decided that she does not want to use any ambulatory aids. And so she's crawling to her house and is an inspiration. So this book, looking at mindfulness, paintings to change the way you live, is a really great book. Pharmaceuticals, I'll just mention very briefly. You'll see patients who have taken all kinds of things, who are still taking all kinds of things. Many times they don't know why someone prescribed them, and it's important to try to help them sort through that. I would say the drug we're using most off-label is low-dose naltrexone, which has been really very, very effective. And just to go over that a little bit, it does seem to help with immunity, inflammation. It acts as a central nervous system anti-inflammatory. It's been used for decades for patients with chronic fatigue syndrome and fibromyalgia, and then it was brought over to the long COVID treatments, and it has been great. The only difference I would say that I have found, having used it prior to COVID for patients, is that the low dose was really kind of maxed out at 5 mg. And now we're seeing patients doing a little bit better with even higher doses, even as long as they don't have any terrible side effects. So I get them up to 5 mg. And if they say, oh, I'm feeling much better, but I still have some symptoms, I'm tolerating it just fine, we do go up more slowly to say 6, 8 mg, and some people using even more. We use a compounding pharmacy to prescribe it. Unfortunately, most of the time it's not covered by insurance. It costs maybe about $30 a month. Of course, that varies depending on where you are. Most of the compounding pharmacies will send it across state lines, and some of them have been really great, like Apothecary Options in California and Belmar Pharmacy in Colorado sends it all over the place. Many people take vitamins and different kinds of supplements. Of course, we know that vitamins are best acquired in their natural packages through food, but as we were saying, many people don't have the energy to eat. They're not eating well, and so they're probably sort of malnourished. And so there are people who we do recommend certain vitamins for. I think people have overdone it with the zinc. And I think they thought that that was going to support their immunity in the acute phase, but then they bring it over to the long COVID. And I think if you eat a generally well-balanced diet, you don't usually need to be taking excess zinc. Then all of these supplements, again, I'm sure you've seen patients taking a whole boatload of these things. And unfortunately, I will say one negative thing about some of the private practice people out there is that they're selling supplements. And I don't think that that's a great ethical decision, to be honest. And many patients who really can't afford it are spending thousands of dollars on supplements that probably are not helping them. But that's not to say that some are not very helpful. Again, you just need to know why you're prescribing them and recommending them, and making sure that the patient understands. We heard about omega-3 fatty acids for improving smell. Turmeric is a great anti-inflammatory. CoQ10 supports mitochondrial function. And so magnesium for headache and muscle aches, et cetera, et cetera. So again, just knowing why you're using them is important. And then there's connection. Many of these people have lost connection. They have terrible fatigue. They don't have the energy to do what they used to be doing or even taking care of themselves or their families. They've lost their jobs. They're having difficulty navigating the medical care system. They have stress, depression, anxiety. And we do know that connection really does contribute to health in so many ways. And so I actually talk with patients in a very specific way. For example, make a phone date with one friend a week, or make sure that you visit with family, have someone come over and share dinner or a meal with them, because they really are losing their connection. And I do worry about what is going to happen to all of these people in 10, 20 years if we don't have a complete cure and they're still dealing with these symptoms. So thank you very much for all of your attention and interest in taking great care of these patients, and happy to answer any questions.